Very welcome, and thank you for allowing me to be here to talk about Alzheimer's from a global perspective and to talk about our World Alzheimer's Report, the 2015. But before I talk about the report, let me first tell you a little bit about Alzheimer's Disease International. We are a global organization represented by 85 member associations, and we're very proud that Seafa and Jesus and all of his team and board members and members are part of ADI and part of a global community. The work of Alzheimer's Disease International is to influence the global health agenda and also to support and strengthen our member organizations all over the world. And we've got member associations in countries in Africa, in the Middle East, in the Pacific, all over the world. And together we have a very strong voice, because when you're trying to influence the global health agenda, you need to all work together. And if you are together, you are strong. And that is what ADI is. We started back in 1984 by 4 organizations, and over the past 30 years we have grown and grown and grown. And only a few months ago we accepted 2 members, one from Cayman Islands and the other from Ghana. So that just shows you the range of our member associations all over the world. And our member associations are the patient organizations, so the organizations that represent the interest of people affected by dementia. And here on red you see all the countries that are a member of Alzheimer's Disease International. And you'll see that Spain is represented there as well, and a whole range of other countries all over the world. And as I said before, together we are strong. My presentation is going to be on the World Alzheimer's Report. Now these reports are researched independently by King's College in London, and over the past, let's say 6 years or so, we have covered a broad range of topic. In 2009 we started looking at the prevalence data on dementia and looking at what these figures are. And when you're trying to advocate for policy change at the global or even at the national level, you need facts and figures. Yeah, and not only facts and figures, but authoritative facts and figures. And that is what these reports represent. They're very conservative in their numbers, and what it is an independently researched report by looking at all the data around the world and looking at all of them individually, looking at the strength of the research and then collating that into one report. The other reports that we did, also the benefits of early diagnosis and early intervention, hugely important report as well. The stigma of dementia, another very important report. Stigma is something that covers a broad range. You might be familiar that in Europe, in Northern Europe, there is stigma. I think that is slowly reducing as we talk about the disease, and even people with dementia are up on stage and talking about the disease. But I can also tell you that in countries like in sub-Saharan Africa, dementia is not understood, and people think of dementia there as witchcraft, as superstition, and as a result people are treated incredibly inhumane. There are even witch camps in countries like Ghana where women with dementia are being sent to by family members. So that just gives you the global perspective of stigma as well. And then long-term care. Obviously dementia is a long-term disease and it requires long-term care. So that report in 2013 provided some really good analysis and suggestions how to structure long-term care for governments in looking after people with dementia. The 2014 report was on risk reduction, very interesting report on how, on a population, how you can reduce the risk of developing dementia. But my presentation is going to be on the 2015 report, which is the latest report that was released in September. September is World Alzheimer's Month, where globally around the world we focus on dementia and create awareness about dementia. But part of the awareness is also launching our report. So this report looks at the prevalence, incidence and the cost of dementia globally. We also have these figures broken down at country level, and they are available if you request that from us. The link to the report, as you can see on the slide, is down below. So, and all these reports, or most of them, we have in Spanish, as well as a number of other languages as well. The reports, they make key recommendations, how to provide a framework for action at a global level, but also at a national level as well. Our member associations, when the report is launched, they also launch that in their country and provide recommendations for their government on what needs to happen and so forth. So let's look at the global prevalence of dementia. So here you can see that according to the research, 46.8 million people have dementia. And basically that number is going to double every 20 years to 131.5 million people by 2050. And if you look at the numbers, I'm going to talk a lot about numbers, but what I want you to understand is behind every number there are people, there are families who are personally affected by this disease. So 131.5 million by 2050 are the people with dementia, the estimated people with dementia. But we also know that for every one person with dementia, there are at least 2 family members involved in their care. So you can easily multiply that figure by a factor of 3 to get a bit of a sense of the true impact of the disease. And then you're starting to see, that the scale of this disease is truly enormous, and the impact on family is very substantial. Because to look after a person with dementia, as you all know, takes many, many, many years, and the burden of the disease sits with the families, fair and squarely, and that is where I believe a lot of support needs to happen, and that is what we are saying to governments, that you need to support families with dementia to look after them in the best possible way. If not, then I believe, and this year's report will hopefully prove that, the cost will be even more to governments around the world. So let's look at this a little bit in a different way. So on the right of your screen, you see the 131.5 million people globally, but here we've got it broken down by continent as well. And there you see, for instance, that in Europe, the prevalence of dementia is roughly going to double. But if you look at a country like Africa, it is quadrupling. And the reason behind that is to do with the aging population and the improvement in healthcare systems. Because ironically, the better our health systems are, the longer people will live, the more likely that they will develop dementia. So the people of 85 years and over, the prevalence there is roughly about 1 in 3. 1 in 3 people aged 85 and above will develop dementia. So there you see the data broken down, in the regional level there. Then if you look at, for instance, in red, Asia, half of the population of people with dementia live in Asia. That's why those balloons, are bigger. And there it is tripling. While in Africa, the numbers that live there are smaller, but it is quadrupling there. So let's look at the prevalence of dementia. Million people that develop the equivalent of 1 person every 3 seconds that is estimated to develop dementia. And much of the increase in people with dementia are in the low and middle income countries. And those are countries where they're least able to cope with this disease, because those governments don't often have a lot of money, don't have a lot of resources, or they've got other higher priorities, like countries in Africa. They've got huge other challenges ahead of them. And so people with dementia in these countries, in these economies, are really struggling, because people are people all over the world. Dementia is truly a global disease, and roughly as many people develop dementia in Africa as in Europe. You know, the incidence is roughly the same. So now let's look at the global cost of dementia. The cost of dementia in 2015 is estimated at $808 billion US, and that will increase in 2018 to $1 trillion US. Now, and by 2030 it will be $2 trillion, roughly, because dementia, the incidence of dementia is doubling every 20 years. So let's put that a little bit into perspective, you know, because these are very large numbers, and, you know, the numbers are so big that they almost are incomprehensible. So if you look at the graph here, we are looking here at the gross domestic product of a country, right? And if dementia was a country, it would have been the 18th largest economy in the world, sitting behind between Netherlands and Turkey in terms of their output as a country. Well, let's look at it a little bit differently. Let's look at dementia compared to the turnover of the largest companies in the world. And you can see here that dementia is even bigger than a company like Apple and Google. And here on this graph you can see, you know, in the light red, the cost of dementia in the low and middle income, or the prevalence, sorry, of dementia in the low and middle income countries. So you can see that in the economies that can least afford, at least have money to do something about it, the impact is truly enormous. So what are we doing on a global stage? In 2013, Prime Minister leader in the UK, and was really taken on board dementia in the UK. And when the UK government had the chairmanship of the G8, and the G8 is, you know, the top 8 industrial countries in the world. Oh yes, he's a tough man. He said that, you know, I'm going to take on dementia on a global perspective. And so what he did is he invited all the health ministers, all the prime ministers to come together and to talk about dementia. And that really was very transformational. And that has resulted in a number of follow-up events, like a number of countries have hosted other events as well to talk about specific topics, about research, about care, and so forth. We also, another result of the meeting was the World Dementia Council, where was more discussion about what we can do globally about dementia and what the impact is. And one of the best ways, and that is our key advocacy platform at Alzheimer's Disease International, is that every country should have a national dementia plan. Most countries are woefully unprepared for dementia. They have not planned for it, and in many cases they are looking sideways. And that is where our patient organizations come into force, because they need to speak up. People with dementia need to speak up. Our organizations are speaking up, and they're saying that as governments need to take more responsibility for developing a plan, because without a plan, nothing will happen very much, and you know, and then the problem even gets bigger and even more costly as well. You can see here that in red all the countries that have a national dementia plan, and are being updated as we speak. Australia was the first country in the world to have a national dementia plan, and then a number of other countries have followed. And I'm very pleased to hear that CEAFA here in Spain, that you're developing on a national dementia plan as well. And I think that is absolutely key, because the only way that you can plan for a doubling of the disease in 20 years and the enormous cost is for your government to have a plan and to have a plan of action. And a plan of action includes a number of things. I think it needs to include early diagnosis and early intervention. It needs to include research, and it needs to particularly include care for families. Because as I said before, it is the families that carry the burden of the disease, and they need to be supported. They need to be supported in training and offering daycare centers, and also helping them to look after their loved one in the best possible way, because it's a cruel disease, and families, they want to look after their loved one, but they need to be supported in doing so. And there are a number of initiatives that would be included in a national dementia plan. I'm not going to go through them. You can read them all there. And some of the key success factors is that they need to have targets, they need to have indicators. So we want to see that most people have received an early diagnosis, because without a diagnosis, there's no treatment. You know, some of the drugs that are available are only available at the early stages of the disease, so the earlier the diagnosis, the better. And families also need to know what they're up against. They need to be supported on their journey as best as possible, and a national plan will achieve that. World Alzheimer's Month is September. I encourage you to have a look on our website and be involved in World Alzheimer's Month. This campaign here was about risk reduction. How can we reduce the risk? There's some really good materials on our website, and I encourage you to have a look at that. And here are some more materials that are all part of the campaign. We talked about smoking. Smoking is very bad for you. We all know that. But what if I told you that, you know, you are also going to increase your likelihood of developing dementia if you smoke? I think that people will think twice, you know, before they start lighting up a cigarette. And these kind of messages are really important, because you know, the increased risk of developing dementia as a result of smoking is something like 45%. And I think that people need to know about it, and it needs to be included in public health messages. You know, we're also part of the NCD Alliance, and that is recognizing that the risk factors of this is my last slide before Jesus kicks me off the stage, and I'm inviting you all to come to Japan. We organize our international conferences around the world. The last one was a month ago in Budapest, and the next one is in Kyoto in Japan. Our conferences are unique in the way that people with dementia talk. And I want to see that, and I didn't see that in the program here, but for next year I would really encourage you to maybe get a person what I'm telling you now, because what they say comes from the they should be involved in all stages of the development, and you know, it's their right, it's their disease, and they need to be involved in it. Now I'm going to stop, and well, if you want to ask me any questions, then come and see me in the break. Muchas gracias.